Well, here we are. It has been Thursday, Friday, Saturday, Sunday, Monday, Tuesday, 6 days since I left the hospital. Yeah, story time. I'm just gonna jump right into it and explain what's going on, what happened, what I plan to do about it, how we're gonna use it to make life better. Battle's over here. My friend Danica gave me this while I was in the hospital, so he's gonna hang out with us while we talk. I have been through a lot of abuse in my life, physically and emotionally, and I have taken great measures to overcome that and to make my life positive and try to be positive to other people. And after a whole year of really focusing on my mental health and trying to fix PTSD and negative thoughts and just, improve life, I got to a really healthy place mentally, and it was the year anniversary of me not having any spicy thoughts, I guess we'll say, any end-all thoughts, and I was very proud of that, so I wanted to celebrate. And along my journey of everything I had to learn, there was a man we weren't even officially dating, we were just talking. Big bodybuilder dude, didn't know his own strength, anger issues. I played too much, he broke my face. Well, my nose, crushed my nose, blood everywhere, got a concussion. And I literally had driven 4 hours to help him move and help him do stuff all day. And he did that and then never apologized for it and just kind of told me to toughen up. And I was in the mindset of I can take anything, it's not a big deal, and I brushed it off, and obviously we didn't end up dating after that, and it became a huge mess later, and I had no boundaries or self-worth, so I just kind of went with it. And then a few weeks later I went back to jiu-jitsu too soon and broke it again, or re-smashed it and it started bleeding and it hurt really bad. I always had an ethnic nose because I'm Eastern European, that's my lineage. Great grandmother straight off the boat, Czechoslovakia, so it was cute. I liked my nose, I didn't have a problem with it, but when he crushed it, it just pulled down funny, and so every time I smiled in pictures, it would pull down, and I don't think anyone else really noticed a change, but I did. After everything I went through and how far I had come, I was I'm gonna celebrate, and you can't erase history, but I just want to get rid of this. I want to smile, and I have braces now too, because they took out my wisdom teeth in the military too early, and my teeth just started gapping like crazy, so I've had braces. And I was when I smile and I'm finally happy again and I'm not depressed and suicidal like I've been for 10 years, I just don't want to think about when I let someone treat me so bad. I don't. It was aesthetics, I didn't have any breathing issues, but it was just, I was celebrating myself and celebrating what I've done. I didn't tell anybody I was getting it done besides my sister, two of my sisters, and my best friend, and my roommate knew that I was getting this done. And so they were gonna, it used to kind of go outward, and then when I smiled, it pulled down. So I was I just want the tip projection up so it doesn't pull down when I smile, and just a little bit of a curve, just make it really feminine, but it would make it thinner. And because it would make my nose thinner, and I just had chubby cheeks, we were gonna remove some of the fat pads, not all of it. I was I do I contour my face, so just what would naturally look like contour, just a little bit out, because it would balance the look, make it look more natural. And I was while you're in there, and it's a really safe surgery, people recover from it. People actually, orthodontists do this surgery for people too, and you can recover in 2 days. You'll be back to work, you'll be fine. You can't eat for the first 24 hours, and then it's soft foods for 72 hours. And I was just easy. You're already breaking my nose. I'm gonna be out of the gym for 2 weeks anyways. I had been training so hard up to that point that I was my body needs a rest. So I'll just do the surgery, I'll recover. No one at work will even know because I wear a mask at work because it's flu season. And I was by the time it heals and by the time we take off masks, no one will even tell. It's just it's not gonna be a big deal, it's just for me. Years ago, I wanted different plastic surgery for insecure reasons, and just full circle where I'm at now. And I was I'm just doing this as a way of celebrating myself. Just how I see tattoos, just how I see makeup. It's just just play with your meat puppet. It's a Sims character, have fun. And so I'm just doing that for myself. I came from a really healthy place. I was proud of where I came from, or where it was coming from. It was an outpatient procedure. My roommate took me and dropped me off at noon. I was done by 5 just because I had to wake up from the propofol. I didn't even get intubated, I didn't get put under. It was just it was more than twilight sedation, but it was, I had dreams. I wasn't out enough that I could feel it, or I wasn't out enough that I was like completely gone. I couldn't feel anything or remember anything, but I had dreams. I woke up from surgery. The anesthesiologist was there. He was a nurse too, and I just fist bumped him. I don't really remember getting in the car. My roommate Mike told me on the way home, I was trying to convince him that guardian angels and haunting someone was the same thing. And then the first week I was just down. Like my face swelled so huge. I'll try to put pictures, but like my face was flat and my lips looked small and like in, because my body's sensitive. So the first week it was like that, and then it started going down, but my left side wouldn't really go down. And then, you know, I went to my follow-up appointment and he like pressed on it and looked at it and like nothing was coming out. And he's just like, sometimes one side heals quicker than the other, right? And when I had my wisdom teeth taken out, which was also a traumatic experience, I woke up in the middle of that surgery. This side got really bruised and like had a hematoma and wouldn't drain. And when I scuba dive, this ear doesn't clear as easy. So I think my eustachian tube is just a little smaller. So I was like, all right, like it's probably just taking longer to drain. I didn't have any fever, chills, or anything like that. Yeah, so I just kept rolling, but I felt off. Like I was like, something's wrong. I called them about it and they were like, no, it's normal. They're like, do you have any fever, chills, any like discharge or like weird taste in your mouth? And I was like, no, it just really hurts. I was like, and it started getting worse with the pain. This side completely had gone down so quick, and it was just like, I looked normal. I was like, if they went down at the same time, no one would have noticed. And I still was like, I decided to take another week off from the gym. I did at one point, once like my nose was healed enough that I could go after the first week, I was like, I'm just gonna go to the gym. I'm not gonna get my blood pressure up. I'm just gonna do 20 pull-ups, because I was so proud that I finally been able to do 20 pull-ups. So I went and did sets of 20 pull-ups with this like huge red ball of a face right here. And I was just like, whatever, like I did this to myself, it's fine. But the pain started getting really bad, and I would like take Tylenol, and at the 6-hour mark, like I could feel it. And I would wake up out of a dead sleep at 6 hours because my face hurt so bad. I couldn't touch it. I couldn't get like my dog, I was like keeping her away, and I was just like, don't touch it. Like I was guarding, and I was like, that's a sign. But I told the doctors everything, and like there really were no other like obvious signs of that. So it was like 2 weeks after, I went back to work, but I didn't have to do, like I wasn't on the ICU floor doing stuff, but I was doing something else. But I was just like sitting all day and kind of moving around more, so I was getting more movement. I had been like taking Battle for little walks, and that helped with some of the like swelling, but then it was just like this, it felt like a rock hard egg. And I watched some videos and Reddit things about people who had the same surgery talking about that, and I was like, wow, that's kind of crazy, right? I was cleaning out my incision, rinsing my mouth, and then like this horrible taste hit me, and I was like, that's infected. That's infection. That's gross. And I just started like pressing on it and spitting into the sink, and yeah, I was just spitting straight pus into the sink at work. So I panic because I'm an ICU nurse, and a little OCD and infection already scares the fuck out of me. And I had also been on an antibiotic for a week after surgery, prophylactically, that's what they do. And so I was like, if this lasted through an antibiotic, this is really bad. So I went and told my manager what was going on. I was like, I have to leave. I called the surgeon first, and I was like, hey, this is going on. He's like, come to the office now. We have to do an emergency washout. Tight. So I leave work, 10 minutes to the surgeon's office. He stayed after hours. He was the only one there though, because it's after hours. And he comes over and he's like, all right, let's have a look at it, because, it could just be putting out fluid, blah, blah, blah. He goes in with the popsicle stick, and he puts his finger on the outside and puts the popsicle stick in there and squeezes it. And I feel pus drain in my mouth, and he coughs and gags. And I was like, yeah, it's that bad, huh? This ain't good. And so I was just like, okay, like, are we going to schedule a surgery for tomorrow? Like, are we going to do washout? He's like, no, this isn't like, no, this isn't something that's just going to keep getting worse. It just suddenly gets really bad. And it didn't hit me till I got home from the hospital how serious it was, because of where it's at and close to your teeth. If you get a tooth infection, it can go straight to your heart, endocarditis, you're fucked. Or it can get into your nasal cavities and your meninges, and it'd be a brain infection. So I was in danger. So yeah, that wasn't cool. So he's like, I'm gonna go get the OR prepped. And I'm like, oh, we're doing this now. And so I texted Mike. I texted him on the way there. I was like, hey, it's infected. I'm going to the surgeons. I texted my sister and my best friend Eliza. And I was like, this is what's going on. I was like, full send, I guess we're doing this here. And so he gets everything set up. I lay down on his gurney in his little OR room, and he puts wrist restraints on me for, just safety. So I'm strapped to a gurney. alone in this office. And for the record, I'm not gonna say his name or his office just because this was such a crazy, like, weird experience, and it was a total freak accident. He was amazing. He did everything he should have done and went above and beyond. Has checked on me, and the results are great. But it's just a freak accident, so we're just not gonna put that on his name. So yeah, he starts numbing me up, and it's not working. And I was like, I feel that. I still feel that. And like, I have to open my mouth willingly for him to get in here. I'm laying strapped to a gurney and just like kind of freaking out, but kind of just being like, it's okay. Like, you know, I get tattoos all the time, and I have a high pain tolerance. This is gonna be fine. Like, it'll be uncomfortable, but like, I just want this infection out of me right now. So he numbs me up and he starts slicing into me, and I feel all of it. And I'm just like trying to breathe through it, and my body's like shaking because I just like can't control it anymore. And then he's like, okay, he's like, do you feel sharp or pressure? I was like, oh, I feel sharp. And so he starts to like slice some more and then do, but like without getting into all the nitty gritty, because honestly, that was really traumatic. I went through an emergency washout while awake, and the numbing didn't work. He said to do that surgery awake for a normal patient who doesn't want to be put under, he uses 10 cc's of lidocaine to numb it. He used 40 cc's of lidocaine, and I still felt it. Like, I'm sure it took the edge off. Like, there's no way it didn't help. But he's like, yeah, infected tissue doesn't numb the same way or at all. And so he's just doing his thing, washing it out. I start crying my eyes out. He's like, you have to hold still. Like, we're gonna lose tools. You have to hold still. I'm sorry. And he would be like in there doing his thing, and then like touching my head, like, shh, it's okay. It's like, it's fine. And I was like, I know, I'm just scared and it hurts. Like, and then he stops in the middle of it. He's like, you know, like, we can go to the hospital if you need to. Like, we can try to call an anesthesiologist and like knock you out, like, if you can't do this. And I was like, I didn't know that was an option, and we're halfway through, so can we just finish? Like, just do it. And so he does it, and it was terrible. And I was like sitting there afterwards, just like in this chair as he was like sending off the sample for he did a culture to obviously see what it was, and was like calling in the antibiotics and the steroids that I need to take after. So I was just like sitting in this little recliner where he was taking my vitals, just like completely deadpan. I'm like, that just happened, and he's just like, it was just so awkward. It was just like the most intense, crazy thing for me. And he's just like on the phone on hold. And I'm just like, what just happened? And I had to drive myself home, and I was just like, that was normal, right? Like, that's okay, that's happened. But honestly, that's like, there's a really low risk of any complications with that surgery, and that's why I was like open to just throwing it on there with the rhinoplasty. But I got lucky, won the lottery, and that happened. So I went and picked up my antibiotics. I called my sister and my best friend, and I just cried because I was like, I just know if I push all these feelings down, it'll turn into cancer in 20 years. So I just need to cry this out and tell you that I just like went through something really traumatic for myself, because I've been through a lot of traumatic things, like, well, some physically, but mostly emotionally. But I was like, this is a little different. And I've been so numb for so long, and I finally got feeling back, and that was what I was excited about mostly with like my whole PTSD healing. But I was like, now I feel all of this. I came home, I told Mike about it all, and I was just sitting there, I was like, is it okay to be like traumatized from that? And he's like, no, dude, that's not normal. You can be very fucked up over that. And I was like, okay, because that is. And then, you know, I just started taking my antibiotics. That was Friday night, and then Saturday, I was shook. I don't even remember what I did Saturday. I set up all my paint stuff and just started painting and hanging out here because I was like, I'm gonna be down for another week. I was afraid to eat because like part of me was like, did I eat too soon, or did I do something wrong that caused an infection? So I was like, I'm just not eating for 3 days. I was like, it's usually like, you know, you progress to soft foods and all that, but I was like, it was way more like, whatever, like, I'm just not gonna eat for a few days until I do a follow-up with him. If he thinks the incision's good, then I'll start like eating yogurt or something like that and just really take it slow. So Sunday, I woke up and I just started, like, every morning after that, I woke up and I was just crying. And I was just like, I saw like the fluorescent lights of the operating room when I woke up, and I would just get like overwhelmed by it. And I was like, I just still feel off. And it was kind of like before when I was like, I feel like it's still infected. Like, I just don't know why this doesn't feel normal. But I was like, maybe I'm paranoid, like whatever. Like, I mean, obviously I'm on antibiotics, so I guess there's technically still infection there. So like, it'll be fine. I hate taking antibiotics because, you know, my stomach. And so I was just like, I just have to stay on my medicine, and I'll just fast as long as possible. I'll only drink water and electrolytes, and like, it'll be fine. I was FaceTiming my sister Sunday morning because I like woke up crying again. I was just like, I feel like something's wrong. I was like, it's still really swollen. It's not going down. And she's like, I'm sure it's fine. Everybody's trying to calm me down. And I smiled at something she said, and pus started leaking into my mouth. And I was like, no, I know what that taste is. I know what it is. So I went upstairs and started spitting into the sink, and I just like pressed it as much as I could and got as like, it was probably a shot glass worth of pus. So I was freaking out. And I had already like cried to Mike that morning, and I was like, if they have to do this again, I can't do it awake. They have to put me under. And he's like, yeah, like, well, he's like, I'll make sure like nothing like that's gonna happen. And I went and talked to, or I called the surgeon. He's like, you need to go to the ER now. And so I went and talked to Mike. I was like, hey, can you take me to the ER? Like, they have to do it again. So we go to the ER, which I'm a veteran. I have VA care, so I go to the VA ER. And they're like, they talk to the doctor on the phone. He wants a CT. They do a CT. My braces though, like scattered it. So like right where they were trying to see, they couldn't fully see, but they're like, it doesn't look like there's a drainable abscess. So maybe we'll just do antibiotics and see if that takes care of it, but we'll talk to your surgeon. They wheel me back from CT, and I walk into the room that me and Mike were waiting in, and I walk over to the sink and I just start spitting pus into the sink, and I was like, there's drainable. It's there. So we were there all day. I was freaking out. Like, I just completely was scattered. Mike explained the entire Star Wars universe to me to distract me, which was great. So now I understand that on a different level. But then my surgeon didn't have privileges at the VA because they're impossible to talk to. And the only place he had privileges is at the hospital I work at. So I had to get transferred to the hospital I am employed at. So I was mortified. But I also was just so scared and ready to get this over with. I was like, let's just go. So I go there, they start me on IV antibiotics, and they scheduled a washout for the next day. So I guess like kind of emergent washout, but they did wait, and I was on like heavy hitter. I was on 𝓔𝓸𝓬𝓻 and vancomycin, which vanco makes your kidneys hurt. I could, as soon as they start that, like my kidneys felt like they were on fire, and I'm like, I should not feel my organs, and I do. But yeah, I was just freaking out. And then the surgery happened. I ended up having to be intubated and like completely put out so they could get in. And my jaw had like gotten shut. Like even the week leading up to it, I couldn't chew food. I couldn't like put food in my mouth. That was like a huge red flag. I don't know why I didn't think, I just thought it was because I wasn't moving it, but it was, I want to say trismus. There's another word for it. But anyways, like I couldn't open my mouth, and then they intubated me and had to open up my mouth to get around the intubation to get into there. So like my jaw was probably like cranked open, and like here to here is still really sore right now. Like just to touch it. So I woke up in excruciating pain. I didn't know where I was, and I just started screaming for Battle. It was like, where's Battle? And they're like, who's Battle? Who's she with? And I was like, Mike has her. And they're like, Mike has her. And I was like, okay. Just laid down. But I was upset. And then the pain hit me, and I was like shaking. I guess that's a reaction to the kind of sedation they used that I hadn't had before. But like I woke up and I thought I was having a seizure, and I was freaking out. They had to give me Demerol, and they gave me Norco, and then I got fentanyl, morphine, and something else when I got to the floor. And that was like, finally it cut the pain, but it just felt like a non-stop Charlie horse on the side of my face, along with burning and stinging everywhere. And I just like, I had my face this way on the bed, and I just was like trying to breathe and couldn't move. And I didn't want to be like a pussy, because I was like, I went through a surgery that was good for me, but like, oh my God, I did not know it was gonna hurt this bad. And I was out for it too. So I'm thankful I was out for it. I'm thankful I had such a good team. I'm thankful my surgeon was so careful, and like, you can barely tell. I'm wearing makeup for the first day, but you can still see the bruise, and there's like this big of like little scar tissue swelling here. This side's completely gone and normal. So yeah, that was kind of traumatic. And then the next day they were supposed to put a midline in, because I was gonna have to be on IV antibiotics for a couple weeks after I left the hospital. At least that was the plan, and I was still on steroids. And then my IV infiltrated, and they couldn't get another one because my body was just freaking out. Every time they found a vein, it would just burst pretty much, or like just, I can't think of the right word right now, but they couldn't get an IV on me. And they had like the house soup and the ICU soup and everybody in there for like 2 hours. And finally the ER supervisor came in, and he was able to get one. But it hurt so bad. Like I can usually take pokes fine, but it was just like my body was such at a limit that them just touching me was like freaking me out. And at the end of that, like when someone would come in just to do vitals or like change my IV, I wasn't like trying to freak out, but my body would just like start shaking like a little chihuahua, because I was just like, I hit my limit. Like I was overwhelmed. I couldn't sleep that night, and I woke up at like, I kept waking up, but I finally sat up at 3 a.m. and I like texted my sister and some friends, and I was just like, I'm at my limit. Like, I need to talk to someone. And I just cried my eyes out for like 2 hours, and then I fell asleep. And then I woke up, and my doctor was there, and he was like checking on everything, and he's like, that swelling isn't going down, and you're not able to open your mouth the way I'd like you to by now. So we're gonna keep you here another day. So that was very sad for the moment, but, and I say all these details just because those are like the lessons I've learned, because I was like, this whole experience is going to make me a better person and a better nurse. Because like when they would come in and explain what they were doing, just little things, and like explaining what they're hanging, or being like, hey, I'm just going to take your vitals, when I was like kind of out of it asleep, because I would always try to like do things and not wake people up. But it was, for me, it was better when they were explaining what they were doing. Like when that first emergency washout, he didn't tell me what he was doing. Like I knew what he was doing, but he wasn't being like, all right, I'm going in now and I'm using suction, I'm doing this. Like he didn't tell me, and I think that made me more anxious. So just like thinking about like, I need to actually explain what I'm doing and take that care. And then like one of the nurses just listened to my story, and I was like, I know this seems stupid, but like I had a big why on why I did this, and her listening to me made me feel more comfortable and more relaxed. And so I was like, I took away from it how to be a better nurse and how to be more just have better bedside manner, which is hilarious because like 2 weeks before that I was talking to Mike about it, and I was like, yeah, I think like, I mean, my clinical knowledge will always have to get better and I'll have to evolve with it, but I was like, I think my bedside is something I need to work on. And the universe was like, gotcha, fam. Here you go, you're gonna learn. So I learned. But I got my midline the next day, and I ended up being discharged. I hadn't eaten since, I went an entire week without eating. Currently, I am down 14 pounds. I have lost all my gains. Which is just crazy that, because I have hypothyroidism. I took my medicine the whole time just because it does have to do with like heart function and healing, so I was careful about that. But I was just like, it's crazy that your body was under that much stress that you just like go through calories like that. And like we always use tube feedings on our critical patients, and sometimes I like wonder, I'm like, would fasting be better for them, or like longer breaks in between to rest their gut? But I'm just seeing how quickly you lose weight. And like I was still mobile. I was like up, well, I was very weak, but I was up and walking around and everything like that. But it was way more serious than I thought while I was in the hospital. Like that hit me afterwards, how bad it could have gotten. But it still wasn't like deathly critical. And with the patients I take care of, I'm just like, I see how much stress their body's under. And I know that it takes, like, if you have an ICU admit and you're there for a certain amount of time, it takes a year for you to actually recover just from being in the ICU. And just like not being able to sleep, how fragile that made my mental state was very evident. I just couldn't handle anything emotionally. The first day I came back, like they did home health. I'm giving myself IV antibiotics every day with like this extension tubing thing. No, why not? You guys just want to see it? Look at that. Yeah, I didn't like it. It clotted because I didn't have heparin the first day, and I just broke down. I was just like, I can't go back. And I knew like it would be so simple. Like I could sit here and be like, oh, this is what we do, so I would take care of it. But it just like emotionally, I was so tired and fragile, and I still hadn't eaten that first day back and everything. Luckily, my neighbor is a nurse and came over and saved the day, and now I'm using heparin on it and it's running fine. But I was just like, I see how like my patients will just get like one lab draw and freaking out at me, and I'm like, stop being ridiculous. But then I'm like, I get it now. Like I get that, like you have a certain limit. But also while I was in there, I kind of was like, this is an opportunity to live how I say I live. And I always say that whatever you're going through, or whatever, like me pushing myself in jiu-jitsu or doing these ice baths or like going on crazy long like ruck runs for no reason on my days off, is I'm like, you train how you fight, and you know, everything is a training opportunity. Like when I have a really bad day at work, or like I'm feeling sick and I have to work, like when I was herxing, when I was going through Lyme treatment, I'd herx and I'd be at work. I'm like, everything's a training opportunity. I just have to be focused during this, and I know it'll pass, and I can just like keep pushing. And so I was like, all right, this is a training opportunity. I can expand my resilience. I can expand my kindness. I can be nice to everybody that walks in my room, even though I'm in pain. I can be accepting of help, which is something I'm not good at. And just thankful for everyone that showed up. And I had some like my managers, co-workers, friends from the ICU. Obviously my roommate was there every night. He was amazing, and we're really good friends, but we definitely like trauma bonded over this whole thing. Just accepting a support system that I've never really had. I was like, that's a silver lining. Like I didn't know I had this group of people around me, and they were all so amazing, and like bringing me coffee and broth and things like that. It was really nice. It was really nice to see. And then it also was like, now I know what really matters in supporting people. Like, I always want to be a supportive person and like healing in my job and just spiritually. And I feel like that's a lot of my purpose, is being a healer in life. I was like, I know how to do it a little bit better now. Or like, I hope so. I know it helped me, so I can try to see what I can do to help other people with that. So there's a lot of silver linings. It was very traumatic. I'll be on IV antibiotics for another week. I can't lift over 10 pounds with this thing in my arm, so I've just been doing like air squats around the house. But the first few days I was just falling asleep. I was so tired. I just looked pale and out of it. I've been eating a lot now, or a lot more, and it does make me feel good, but like my body is not keeping anything. IV antibiotics have wrecked my tummy. So yeah. So the next part of this, though, is what we're gonna do with this situation, because you know, when you hit rock bottom, you have a sturdy place to build from. And that's, I mean, emotionally I'm not at rock bottom because I did have such a great support system, and I'm healthy and I'm moving and I'm gonna bounce back really fast. But physically, we're a little fuckered up. I've had chronic stomach issues, probably because of the Lyme and stress, and I just had a lot of food allergies I didn't know about, so there's just a lot of inflammation. I was working with that with my Lyme doctor for the past few months. I have hypothyroidism, so like losing weight and gaining muscle is just hard for my body, and I overtrain like a motherfucker because I love it, and that's been a detriment to me. And that was kind of something I learned here about like how much rest really can help, because like I feel weak, but my back pain, my knee pain, my hip pain, all this stuff that's been chronic in my life feels really good right now, because I have not been doing anything for 3 weeks, and I haven't done that ever. So eventually I'm gonna go back to school and get my nurse practitioner, and I've decided this a while ago, and I was like, I'm gonna help people optimize their hormones and build muscle and lead a resilient life and help their communities be healthy and build America back up from the inside through just like a healthy, strong nation that cares about relationships and community and the well-being of the people around them and their environment and their bodies, right? Like, that's my big mission. And I had like this whole game plan written out that I'm still using, like this EOS binder I'll eventually put on here and show everybody, because I'm so excited. I just love organization. I'm so excited about it. I get to practice what I'm preaching, or will preach, once I get my degree, and I'm going to have to rebuild my gut microbiome and my digestive system. I'm going to have to rebuild the years of lifting and agility that I have worked up to from ground zero, it feels like. And just the mental fortitude of losing all that and having to start over. So it's going to be Operation Romanus Constructum. Me and Mike came up with that because I was like, I have to build back up my gut and my glutes, so let's go. So that's what we're gonna be doing right now. I'm on antibiotics, so it's just mitigating that. I'm taking a lot of glutamine and collagen proteins in the morning, and then I take a probiotic before I eat, and I try to eat like 2 or 3 hours after my antibiotics. It's still gonna be my system, but just so it's a lesser amount, and so that the probiotics can actually try to absorb some stuff. So we're just trying to keep my weight stable. I'm already down another pound since I've started eating, and like I said, I'm eating a lot. I prescribe to a low inflammation diet just because I am so sensitive. So meat, just lots of meat. I got, you know, grass-fed Oregon meat, ground up and ground beef, and bison, lots of eggs. Gonna start making some of my own bone broth. And because my body's just not absorbing nutrients, it seems like, and I'm still losing weight, I think I'm gonna start making some pemmican, because it hurts to chew and it's hard to eat that much food right now. So I was like, I just need really dense, like if I can make pemmican out of like liver, and not just liver, but like organ meats, I was like, that'd be a good way to get calories in, and hopefully it being higher fat, it doesn't just go right through me, because your body digests that a little differently. So that's my nutrition side of it. And I'm gonna just do body weight workouts and go for walks and go for hikes and like get some endurance back up, and you know, take Bella for a walk because she's been down about as long as I am. And then I have a friend, Kyle, who I've hired as a trainer. And before this, like the whole thing, I was switching to like functional fitness. I was like, I want to be strong, I want to be powerful, but like I need the agility of it. Like it doesn't matter if I'm strong if I can't use it. And so I'm switching more to a more functional fitness, because I come from a bodybuilding background. And so I was like, I was strong, but what do I do with it? I was like, I want to be able to do handstands and like throw kettlebells and push sleds and do that, and everything I do in the gym, I want to be able to translate to jiu-jitsu, and I want that to be able to benefit me in hunting season. So yeah, we're rebuilding my body and we're strengthening the mind, and we're gonna go about this in a really healthy way. And my big goals, because I have a lot of big goals and like a lot of things I was gonna do this year, but I've kind of narrowed it down to my 30th birthday is in June, and I'm going to the beach with my friends and my sister, and it's gonna be amazing. And I know how like this whole thing brought me down to like just being really present and happy in the moment, and like how fragile life is, of course. So I'm just trying to get healthy enough to go on that trip and be with them, and you know, foster that community I have with them. And then September, elk season. Like those are my two markers. Like we're just gonna keep grinding till then. And then right before I go to the beach is the what is it called? It's a hunt fest. I'm doing a pack out challenge, so I'll be, you know, getting my hiking endurance back up. So like that's what we're aiming for. Just, you know, getting healthy enough to travel and go just be at the beach and experience amazing nature, and then hunting season. So yeah, you guys want to follow along. I'm just gonna start documenting it because this is my own experiment. One day I'll have patients who have gone through similar things or worse things, and I can be like, I've been there, and I can really empathize and help, and you know, find some mistakes along the way and become a better nurse and a better person and a better human. And yeah, I'm really excited. It's gonna be good. Battle, come here. This is my service dog, Battle. She's gonna come make an appearance. Come here, baby. She has been my little angel during this whole thing. She lays on, I've been so cold too. She lays on me every night. She's been really protective. I've had her for a couple years now. I was giving her, actually I have some videos on that whole story with her, but she's really come a far way. So she's gonna be my training buddy on the trails. Once I get this midline out, we'll start getting back to the range. I got hiccups. I don't know what time it is. I'm gonna go get my nails done because I've never really done that. You're jealous of this guy, aren't you? You jealous? Come here. Come here. You can't eat that. Eat that. So yeah, my name is Sapphire. I forgot to tell you that. Don't eat that, honey. This is Battle, and we're about to have a badass fucking year. Gonna build it from the ground up. I can't think of anything else I want to say. So we're just gonna, I'm gonna put some YouTube videos up, longer form like this, just explaining like bigger updates. And then I'm just gonna do like daily little vlogs on Instagram because I was already tracking my Lyme treatment, which obviously is gonna take a pause right now. And maybe it's cured with all the antibiotics coursing through my veins. That would be amazing. 2 birds, 1 stone. But have a great day.